Hello, everyone. This is Ceres again, the 3rd Congressional District in North Carolina, running for Congress. And today I want to talk to you about an issue that is very important to the citizens of the 3rd District, and that is the state of our healthcare system. A lot of us worry about whether we're going to get sick or not because it could be financially ruinous for many of us, especially those of us that live paycheck to paycheck or have healthcare insurance, but it might not cover everything, or we just don't even have healthcare insurance, or even more importantly, we just don't have access to it because a lot of people in our rural communities have to travel upwards of an hour just to get to a hospital. And this has been a growing problem in rural North Carolina. And today I read an article that disturbed me. It was put out by the Bipartisan Policy Center, and it stated that the conclusion was perhaps we do not need these hospitals in rural areas. Now, that's very easy to say from a policy analysis perspective. Very, very different when you're talking about people. And that's what it comes down to. It's saying that certain people matter in urban areas and people in rural areas do not matter as much. And I fundamentally disagree with that. And I think we need to do whatever we can to save our hospitals in the rural areas. For example, in 2014, we had a hospital in Pungo that closed down. And residents in Pungo now have to travel much further to get emergency medical care. In addition, we have a hospital in Washington County, which is just outside of the 3rd District, which is suspected to be under threat of closure. And again, where are these people supposed to go when they need their health care? And fundamentally, I find this to be wrong. And it's not just a factor of market forces. If it was just a factor of market forces, there might be that argument that there was not a need for those hospitals in the area, but that's not what's going on. What's going on is that the government has stepped into the healthcare field way too much. And what is happening is that our costs as working class people are going sky high, while the political class and the wealthy don't have to really worry about it because they either have Cadillac plan insurance or they have insurance which covers everything, or they just have lots of money and don't need to worry about the costs that are incurred. But for the average person in this district, this is a huge issue. And why this happens is because we have a huge hospital lobby in the state of North Carolina. And what they've done is they have enacted what we call certificate of need laws. And certificate of need laws limit how many hospitals can be in a certain area, how much expansion can happen, how many MRI machines can be put in an area, dialysis machines, things like that. And the thought is that you don't want to saturate an area too much. The effect has been that the big hospital conglomerates have been able to monopolize the hospital industry. And so our costs as individuals have gone up, while our quality of care has gone down, our patient wait times have increased, and our costs have skyrocketed. And all the while, these conglomerates are making huge profits. This is not a market-driven situation. This is caused by the certificate of need laws. And the state of North Carolina and several other states are not going to repeal them because the hospital lobby in the states is so strong. That's why I propose that we, if elected, I will push for a federal ban on certificate of need laws. This would allow more competition amongst hospitals. It would allow the expansion of existing rural hospitals. It would allow new hospitals to be created. And it's a free market-based solution for the citizens of this district. In addition, we have to have transparency in the way we are treated by the hospitals. It's one thing to say that you don't want government interference in the healthcare system, which I absolutely do not. And Obamacare has driven up premiums, and we need to repeal Obamacare immediately. We need to repeal it, and we need to keep the government out as much as possible. But you cannot have a free market when you have no transparency. And one of the things that we do not have transparency in is the way that the medical field bills us. So you get you go to the hospital and you go in for surgery. Half the time they give you a Band-Aid, they charge you for an entire box of Band-Aids. And they charge your insurance company for an entire box of Band-Aids. Driving up premiums, driving up your costs, driving up out-of-pocket costs. And this is wrong. You can request to have an itemized bill, but I want to have federal legislation that requires that when you go to the emergency room or you go for a hospital visit, the hospital must disclose an itemized bill of everything they've charged you. And that way they cannot overcharge you for services such as Band-Aids or aspirin and charge you for an entire box of aspirin, a bottle of aspirin because you've had one or two aspirin. You could catch that right away instead of having to go through a bureaucracy to get that itemized bill. All bills would be required to be given to you in itemized bills. And I think that this would help the average person in this district with their healthcare situations. And these are just two ways that we can use free market-based solutions and solutions that are for the working class and for the middle class in this district to help us with our healthcare system and dealing with the healthcare system and give us a little peace of mind. So I ask for your support and I ask for your vote. You can go to ceresforcongress.com. You can visit me on Ceres for Congress on Facebook, and I ask for your vote on April 30th or your vote in the early voting. Thank you.